So vitamin K actually helps our bodies produce clots. And of course we need clots to stop bleeding. So if we're deficient in vitamin K, then we have a problem forming clots and we can actually suffer hemorrhages. Hi everyone, this is Dr. Liz over at Pediatrics, and today I wanted to talk about vitamin K. We've been noticing more and more that parents are opting out of vitamin K injection in the hospital. So why are babies born with such low levels of vitamin K that it puts them at risk for vitamin K deficiency bleeding? One of the big reasons is because there's very little transfer of vitamin K from the mother through the placenta to the infant during pregnancy. The other is that the infant gut is often very, very low in bacteria, and healthy bacteria in our guts actually can help us produce some vitamin K. How do older kids get vitamin K? They start eating foods like leafy green vegetables, meats, dairy, and eggs, and those foods can help us basically produce vitamin K in our bodies. They also actually have a microbiome at that point also, where we have billions of bacteria in our guts that can help us produce vitamin K internally. There's three different types that we run into. There's early onset, which can present within 24 hours after birth. There's classic, and that one presents anywhere between a couple of days to actually a week or so after delivery. And then there's the late onset, which is rarer, and that one can present up to 6 months after birth. So how does that present? You might see in the early type or the classic bleeding from the umbilical stump or bleeding from a circumcision site, for example, easy bruisability, especially around the face or the scalp. Very commonly, you can have internal bleeding, and that can present as intraventricular hemorrhage in the brain and also gastrointestinal bleeding, internal bleeding. And by the time that is detected, it actually can lead to mortality in the infant or the death of the infant. So those are the big reasons why we give vitamin K, because it's entirely preventable in terms of vitamin K deficiency bleeding. And parents often will ask me also if vitamin K given orally is just as effective, and the answer is no. Vitamin K orally ingested is very poorly absorbed, and it is not very effective in preventing vitamin K deficiency bleeding. So for this reason, we do recommend the injection form. So if you guys have any questions about this, please reach your provider. Call your OBs if you're pregnant and you have questions about this. Discuss this with them. Call your pediatrician and ask them, about it. The vitamin K injection is very safe with very good efficacy, meaning that it's very effective in preventing vitamin K deficiency bleeding. So just reach out to your providers if you have questions, and we can absolutely discuss with you further. Have a great day. Bye-bye.